over we're here to go over some best practices for what we're calling holistic homelessness housing and services. So this includes trauma-informed, low-barrier, housing-focused, and person-centered services. Um, so as you saw, we are recording today. And before we dive in, let's just go through some housekeeping on the next slide. Yeah, there we go. So I know we're all used to Zoom already, but some quick Zoom tips to help guide today's discussion. First off, you all should have been muted when you came in. Please stay muted when you are not talking, just to decrease background noise. We do have a lot of participants today, so I want to make sure that we can hear one another when someone is speaking, but also feel free to unmute when you have a question or a comment. We really encourage interaction with us. So, I know we're all in our little tiny boxes, in our virtual worlds, but really want to encourage y'all to unmute when you have something to say. So feel free to do so. Also, if you need closed captioning, you can enable that. There's that little, usually in your toolbar, there's a round circle with 3 dots that says more. And if you click on that, you should be able to turn on closed captioning. If you have questions, you can either raise your hand and unmute and ask them, or put them into chat, and we'll try to keep an eye on chat as we are presenting today. Also, if you have any tech issues, you can send a direct chat to, most of the time, to either Garen or Michelle, who are my colleagues here today, that will introduce ourselves in just a moment. Because I'm going to be presenting a lot of it, although there's part of it that Garen will be presenting. So if Garen's presenting, you can chat to me. Also, if you get kicked out, take down our email address, sanmateo@homebaseccc.org. You can try to email us, and we will try our best to keep an eye on that email in case anyone has technical issues. Okay, let's go to the next slide. So this is our welcome slide, our introductions. Our home-based team today, as we said, myself, I'm Deborah Edelman. I am a directing analyst at Homebase. Been here for about 6 years and been working in the Bay Area in the homeless and housing services field for much, much longer. I won't, age myself. My gray hair under the purple does that itself. And we have Michelle and Garen here. I'm going to let you both introduce yourselves quickly, while others, I'm encouraging you to enter into chat. Please introduce yourselves with your name, your organization, what your title or role is with the organization, or what your role is within the homeless and housing field within the system of care. Also, how long have you been interacting with the homelessness system of care? So really curious, it doesn't have to be an exact number. This isn't a coordinated entry assessment or anything like that. But yeah, give us a sense of how long have you been interacting with the homelessness system of care. And Michelle and Garen, introduce yourselves quickly.
Great. Hi, everyone. Good morning. I'm Michelle Burns, also with Homebase, and work with Deborah and Garen on working a lot in San Mateo County, as well as with our colleague Lynn, who you will also probably see in future trainings. Nice to see you all.
Hi, everybody. I'm Garen. You will see me in these trainings. You'll see me, if your organization is doing technical assistance with us, you'll see me in those. Um, I'm a directing analyst here at Homebase, and I've been working in various roles in the homelessness system of care for about 15 years.
Awesome, thanks. And I just realized I didn't say how long I've been working in the homelessness system of care. I got to think about that. But it has been about 28 years. Yeah. Um, So yeah, and I'm seeing a lot of long timers as well as those who are who have just been working for a few months in the field. So it looks like we have a good range of experience and a lot of different. I'm also seeing a lot of different roles that you all play, but a lot of case managers, coordinators, case managers, also some directors. So great. Keep on introducing yourselves in the chat. We'll keep an eye on that because it's good for me to have an idea of who's here. And next slide. Now it is HSA's turn, the San Mateo County Human Service Agency's turn to introduce yourselves. And if you have any announcements, feel free to share them.
Sure. Good morning. This is Kalia Parrish. I work at the San Mateo County Human Services Agency in the Center on Homelessness. We are a coordinator and funder of homeless services within the county and work with most of your agencies to just partner with you all to do all the great services that you do. So want to thank you all for taking time out of your day to attend this training. Not all of the trainings that we partner with Homebase to put out are applicable to all of our homeless services, but this one is. So glad to see a good group here today. And we partner with Homebase to put out these trainings on homeless services. So looking forward to what Homebase can coach us and facilitate us on in terms of best practices for really engaging with our clients in the most low barrier and trauma-informed ways to ensure that we're providing person-centered services that help our folks get housed. So again, thanks for your time today. I'm joined by my colleague, Leslie, and be here in the background if any system questions come up. Pass it back to Homebase.
Thanks, Kalia. And yes, the next slide, we're just going to quickly go over the agenda and how we're planning to go over these concepts, these of best practices for what we're calling holistic homelessness and housing services. So we'll introduce the concepts first of trauma-informed, low barrier, housing-focused, and person-centered services. Then we'll go over a little bit more detailed overview of what trauma-informed services are. And actually this is, there was a slight change because the timing we looked at, so we'll actually have a break after going over the more in depth over an overview of trauma-informed services. And then we'll come back and look at, why do we want to implement holistic homelessness and housing services with this focus? And what are the outcomes? What are the results of implementing services in this way? And talk a little bit about engaging participants in services. And then we'll have a chance to break into breakout groups and discuss some scenarios and how you all implement this, and then come back and have hopefully have some time for some report backs and question and answers. So that's just a quick overview, and let's jump into it. But before going back to the group agreements, if you've been in other training sessions with me, I like to start out with some group agreements that we propose to to provide a safe space and an open learning environment, really. So we want to assume best intentions, from all of us here today, all 46 of us that I see here, that we're all here with the best intentions to learn, right? And to think through how are we implementing services with the participants that we're working with on a day-to-day basis. So we're hoping that you'll all participate actively in your learning. And that means however works best for you. So, we know on Zoom, if it works best for you to have that video on or off, if you need to get up and take a bio break, grab something to drink, do it, be here however works best for you to support your learning, right? But do try to limit distractions, avoid multitasking if at all possible. Be here to learn and take care of yourself. Like to see or just get pause for a moment. Are there any other agreements that people would like to propose? You can unmute, you can put it into chat. Anything else you'd like to see from this space today to ensure that it is a safe learning space for everyone? Okay, I'm going to take the silence as implied consent, but I also just want to, I will also want to offer compassionate caution is what I'm calling before we begin. So today, we're going to be talking a little bit about trauma and its impact. And that can have an effect on your own reactions and thoughts, especially if you're personally connected to some of the information that we're discussing and sharing. So just want to encourage you, as I said, as it says, take care of yourself, pay attention, however you need to. If you need to take a breath, take a step back, stand up, move your body, stretch, get some water or some tea or some coffee, pet your kitty cat who just came into your lap like me, please do so. I just want to encourage you to, take care of yourselves today. Okay, next slide. So a quick check-in. Type into the chat. This is just curious how you yourself would rate yourself, your knowledge right now of the concepts of trauma-informed, low-barrier, housing-focused, and person-centered services. So this is on a scale of 1 to 5. You can just put the number in there. And if you don't want to post it to everyone, you can just post it to me as a direct chat. But yeah, give me an indication of, have you heard of these terms? Do you know about the concepts but want to gain more understanding of them? Do you feel like you know them and understand them but can always use practice? Or you really feel that you're very confident and you're an expert and you feel very confident in implementing these. You implement trauma-informed care, low barrier services, housing focused and person-centered services on a regular basis. Okay, I'm seeing a lot of 4s, a lot of 3 or 4s coming in, and that is completely understandable, right? Looking at how many years of experience and what you all have been doing. It's very understandable that you all have heard these concepts, you know these concepts, but yeah, we can always use practice with them. So hopefully we'll have some overview, some reminders, and hopefully some aha moments, and then looking at how we implement these in our day-to-day work. Next slide, very quickly. So our desired training outcome from this is really that the participants that you're working with are going to be provided with, will be consistently provided with services, housing, and support that, recognizes the impact of trauma on, their physical health, their behavioral health, their relationships, is engaging and easy to access, focuses on housing as the primary, although not the only goal, and really meets participants' support needs where they're at. So now I am going to take a quick break myself and pass the baton to Garen to introduce the concepts.
Hey everybody. Yeah, so we can just go right to the next slide. Um, yeah, so you kind of heard Devra say this a couple times. All of these hyphenated words kind of in sequence. And I think our sort of proposition today is that these are all like very tightly related concepts and very tightly related methods of intervening in homelessness systems. But each of these terms kind of has its own history. We could be doing a training on each of these things individually and going super deep on each of these little hyphenated concepts on their own. So we want to start with that. We're not going to go super deep, but we're going to start by kind of talking about these four things in this Venn diagram in isolation. And then I'm positive that like as we go through these, you're going to see like these little shaded areas. You're going to sort of hear me saying the same things over and over as we go through each slide. But we thought it was important to start by acknowledging that these are four different concepts with different histories that come from different places. So yeah, we just sort of wanted to start there. Um, so yeah, why don't we start? Let's go ahead and start with with the first one, which is trauma informed. And I just want to read this quote aloud. So, trauma-informed care is human-informed care. And when you think about that word human, you think about like your body, you think about your mind, and I think like and I want to start just by thinking about that word human and like the different parts of being human, and because that's very related to the word trauma as well. So you all might know this, but the word trauma on its own just means wound, like as its sort of like root word. And if you've watched like TV, if you've watched like ER or Grey's Anatomy or something like that, you'll hear the word trauma used a lot to refer to kind of like physical injuries. And I kind of want to like run with that analogy just for a second of like physical trauma as an analogy also for like psychological trauma. So just as an example, I am right-handed, and if I broke my right hand, that would sort of be a trauma to my right hand. And the treatment for that would include some medical care. I would probably get a cast. My arm would probably be in a sling. But there were also just a lot of things about my life that would change. Like, I would have to learn to use my left hand to write. I would have to learn to use my left hand to eat. I would have to sort of maybe rearrange my space in certain ways. I would need some help from some other folks to do certain things. And um, and that's all sort of to support the healing of my right hand. And that's kind of the essence of trauma-informed care, even in the sense of like psychological trauma. So it's providing clinical care, so like referring to a therapist or providing that sort of like clinical care. But it's also like looking at the physical environment. It's also making arrangements for someone to sort of not reopen that wound and also to sort of like support that healing. So it's like that word trauma sort of applies across all of the aspects of being human, both sort of physical and psychological. So yeah, so let's take a look at like yeah, what are trauma-informed services like in the sort of like clinical care sense. So this is an approach to engaging people that recognizes the prevalence, signs and impacts of trauma. It integrates knowledge of trauma into policies and practices, and it also supports environments that avoid re-traumatization. So yeah, there's this emphasis, so an emphasis on knowledge of trauma sort of across all levels of an organization or a program. Um, Recognizing that people might have a lot of different traumatic experiences, and those are going to sort of present themselves or make themselves evident at different points in their lives as they're sort of moving about the world. And also kind of aiming to provide services in a way that promotes restoration, well-being, growth. Um, I also just want to call back to this top box, just the words integrating knowledge of trauma into specifically policies and practices. I want to like I want to really like highlight that word policies. So yeah, just another aspect of trauma-informed services is that it should be an organizational approach. Like there are a lot of things that you can do like at your desk as a direct service provider that are trauma-informed. But it's also about creating this trauma-informed environment for the program participant. And that's going to involve some things that are like programmatic or organizational in nature and not just kind of not just in like kind of a direct service context. So yeah, let's look at some of these core principles on the next slide. So this first one, I've said this a couple times. So trauma understanding. So yeah, having knowledge and understanding of trauma and its kind of causes and effects. And like I said, kind of all across the org chart, like everybody should have this knowledge. Safety and security. So yeah, increasing safety and stability, creating the right routine. Like I think we all take comfort like in our routines and the things that are like kind of predictable about our lives. And yeah, so creating the right routine kind of creates that security and promotes healing. Um, yeah, cultural humility and responsiveness. So, yeah, I think like conflict often kind of arises from cultural difference. So it's kind of the work of understanding cultural differences, the aspects of and the kind of cultural aspects of why someone might react the way that they do in certain situations. And that's a real key component of providing trauma-informed care. And then, yeah, compassion and dependability. So another way to say that is kind of, or a very specific way of saying that would be kind of following through. So yeah, really, if you said you're gonna like look into something or provide a referral, it's actually like sort of following through on that next step or following through on that. And also kind of taking a look at what is like within your ability to provide as a provider and like following through on those things. Yeah. So the next one, collaboration and empowerment. So the one kind of piece of that word empowerment is, oh, Michelle, I think the video just changed a bit and we see like your face on one side and then the slide's really small on the other side. Okay, there we go. So yeah, collaboration and empowerment. So one aspect of empowerment is like choice, is like client choice. So yeah, providing kind of a menu of options, allowing someone to have a voice in their care. And yeah, just like identifying a really clear role that the client is sort of playing in the program and in their own sort of treatment plan. And then this last one, resilience and recovery. So identifying strengths. Um, and yeah, like remember if we want to kind of like go back to that analogy that I made about like my right hand, um, in that analogy, I still had like kind of a perfectly functional left hand. So yeah, identifying the things that someone still has the ability to do, still has the capacity to do, and really like sort of leaning into those things, building those strengths. And that's really a key aspect of trauma-informed care. All right. Devra is going to go way, way deeper on trauma-informed care in a bit. So we're going to move on to the next one, which is low barrier and housing focused. So yeah, we decided. So I'm already sort of like breaking my rule that I mentioned earlier that we're going to talk about all of these separately. These two are very closely related, so we're going to sort of talk about these two next to each other. So yeah, low barrier and housing focused. These services are remove obstacles and provide a supportive environment to obtain and maintain permanent housing. Um, so yeah, on the next slide, we'll just to talk about a couple of key characteristics of low barrier and housing focused programs. So this first one, I'm sure you all are familiar with these. So there are few or no requirements for entry into and ongoing services or housing. So those requirements could be things like sobriety, a minimum income, a lack of a criminal record, participation in services, and other sort of unnecessary conditions. And they could also include some reasons why someone would be like rejected or like exited from housing. So like those could also be like poor credit or financial history, a lack of a rental history, minor criminal convictions. So all of these requirements would not sort of exit someone or prevent someone from entering housing. And then the next one is accommodations. So yeah, just making all possible efforts to allow participants to have things like pets, to store their possessions, and yeah, to be with partners or chosen family, to have a private space, and also proactively providing accommodations to ensure fair access to people with disabilities. And then this next one, identifying alternatives. So yeah, if your program doesn't have the ability to serve someone, or that would be sort of working through the coordinated entry process to support that household in accessing a program that does meet their needs and does fit their needs, and sort of seeing that as a part of your role as a program, even if they're not going to be entered into your program. That would be another aspect of like low barrier and housing focused services. Um, then resources and support. So yeah, like case management and supportive services are sort of provided on a voluntary basis. So like housing navigation support, employment services, mainstream benefits, and other resources to secure and maintain housing. This one, I'm gonna just make this first connection to the trauma-informed care piece here. It's that idea of like empowering someone to, like it, rather than mandating all of these things, providing these things as like a list of things that they have the ability to access if they want to. It's like a menu of things that they can engage in if they want. Just giving folks that choice often actually makes people more likely to engage in services and definitely makes their experience of them a lot better. Um, so next is engaging in problem solving. So emphasizing problem solving over kind of like therapeutic goals. So that's that idea of like collaboration that we talked about on the previous slide about trauma-informed care. And then this last one is a focus on prevention. So seeking to kind of prevent disputes or like prevent those like rule violations that might end up with someone being exited from housing or like yeah, through kind of like clear communication about expectations, recommendations, policies and procedures. And then, yeah, having policies that focus on supporting the maintenance of tenancy. So that those could be things like grievance procedures, eviction prevention support, mediation if disputes arise in your program. So those are all, yeah, taking a proactive approach. So before things happen, having policies and practices in place that would prevent those things from happening. So, yeah, I think like, yeah, we've already made a couple of connections with trauma-informed care here. But yeah, just to sort of cement some of those, like this focus on prevention and like creating the policy environment that would like sort of prevent disputes before they happen. That is certainly a trauma-informed practice. Um, the like we talked about kind of resilience and recovery and identifying strengths. So yeah, that's sort of in here too, this kind of encouraging engagement and problem solving. That's like sort of a clear connection between these models. All right, we've got one more. Just moving on to the next slide, and that's person-centered. And yeah, this is probably the most straightforward of the principles that we're going to go over. It's sort of right there in the title. Person-centered services focus first and foremost on the program participants and their unique strengths and needs. I remember like when person-centered services was first described to me, like in social work school, um, what I think the analogy that someone used was like if your participant wants to be an astronaut, that's in their housing plan. Like what are the aspects of being an astronaut like that would like be supported if they were in housing? Like that's sort of what the conversation turns into, and it's all about being an astronaut and not necessarily about housing, but housing is still in there. It's not the best analogy, but that's just sort of always stuck in my mind that like you're starting with what the client wants, what they're sort of saying their goals are, what their sort of hopes and dreams are, and everything else sort of follows from there. So, some of the characteristics of this, so empowerment and understanding. So, yeah, participants have the choice and the power to actively participate in their recovery from homelessness. So, yeah, a person-centered service plan would sort of incorporate a participant's unique goals. You'd be able to kind of look at that service plan and sort of see the role that a participant is going to play in their own path forward. Excuse me. So, collaboration, sorry, I skipped understanding, but that was sort of like incorporated into like, I meant for that to be sort of included in what I was just saying, like understanding the client's, their specific strengths, their situation, and kind of guiding and seeing how those are related to housing solutions. So the next one is collaboration. So yeah, collaboration between program staff and participants to share power in decision making and foster self-determination. So yeah, working in a person-centered setting, it should look like kind of a conversation. It should be sort of bouncing ideas off each other, not providing sort of strict direction in a housing plan. It's kind of a collaborative process. And then this last one, mobilization of a participant's strengths and community resources to enhance resilience and meet goals. So I sort of think of this as like having like a planning phase and a launch phase. So like you have this very collaborative conversation about their goals, community resources that you have access to and that you're able to refer to or provide, and then you get moving. So you like you start by having that conversation and then you sort of put that plan into implementation. Yeah, I bet you'll notice like every single one of these concepts is one that has like kind of we've already talked about in some fashion on the previous slides. Um, so yeah, using a person-centered approach, just a really good tool in providing trauma-informed care, like focusing on a client's unique goals and strengths rather than like rules and requirements. And that's also kind of a great step in the direction of having like a low barrier housing focused program as well. All right. I'm gonna hand it back to Devra in a second, who's going to like I said, sort of like dive deep onto trauma-informed care. Before we move on, I want to do like a brief exercise, and it's on the next slide. Um, so there's going to be a big, like, scary brick of text on the screen. I'm going to read it aloud. I'm also going to put it in the chat box. So yeah, feel free to read at your leisure. Oh, it's too big. It's too big for the chat box. That's hilarious. Um, so why don't we keep it out of the chat box? I'll read it aloud and like read along on the screen, whichever way is helpful for you. So Stacy is a case manager at a permanent supportive housing program working with her client Denise. Stacy started her work with Denise by discussing her goals for her career and her personal life. Stacy focused on listening and documenting those goals and brainstorming ways to pursue those goals rather than providing suggestions. Denise disclosed a history of substance abuse and a fear of relapse. Stacy made Denise aware of addiction and recovery services that are available in the community and made it clear that it was her choice to engage in those, and her participation or lack of participation in those services wouldn't affect the status of her housing. She also brainstormed strategies that Denise could use to avoid contact with other residents who might be active users. Denise also disclosed a history of abuse. Stacy worked with Denise on simple strategies to manage her anxiety and has made referrals to mental health providers. She has also worked with other program staff to make sure that Denise's schedule and interactions with other residents and staff will minimize her stress. So I want to just very, very quickly, very low stakes. I want us to like try and answer these questions. So, which aspects of this case study indicate a trauma-informed approach, a person-centered approach, a low barrier approach? And you can raise your hand and come off mute and share. You can also share in the chat box if you're more comfortable with that. Anybody have thoughts? Which of these aspects would sort of fit into which of these categories? I'll give another second in case people are typing in the chat. We've got one. Thank you, Garrick. So yeah, strategies. So yeah, strategies to avoid contact with active users. Yeah, that one would be, I don't know, which one would that be, Garrick, from your opinion? Yep, low barrier would be her choice to engage in the recovery process. Yep. Yeah, exactly. Like it's her choice to engage or not engage. That makes it low barrier. Let's see if we can get one more. Yeah, trauma informed. Denise had a space to share her history of abuse and substance use. Stacey provided resources to address support she might need with topics. Perfect. Yep. These are great. And I think this is having exactly the intended effect because I sort of like drafted this case study with like this one's trauma, this thing's trauma informed, this thing's low barrier, this thing's person centered, and already you all are sort of like showing me that all of these things are kind of all of these things. Like, yeah, the thing that I had sort of drafted as trauma informed, which was like kind of the history of abuse and like sort of rearranging her schedule. Also, the substance use piece is a piece of trauma informed practice. Like the yeah. So I think yeah, I got another one as a private chat. So I'm listening instead of providing suggestions is a person-centered approach. Perfect. Yeah. So yeah, these are great. So I think like we're all sort of like seeing these things as distinct concepts, but also sort of seeing the connections between them, which is perfect. And I think with that, I can hand it back to Deborah.
Awesome. Thank you, Garen. Um, yeah, so now I know these, as we saw with what Garen was just presenting, is that and this is why we call it holistic services, is because, you know, being aware of the effects of trauma, seeking to reduce as many barriers as possible to participation, focusing on the primary goal, but not the only goal of housing, and on participants' unique strengths and needs as they define them it's an integral part of providing services to really support participants' well-being. Um, but we're going to dig in now in the next 20, 25 minutes or so into just a little bit more into trauma-informed services. This is something that, as Garen said before, we can do, whole trainings on all of these concepts, and in particular trauma-informed services. But want to dig a little bit more into trauma-informed before we then tie it all back together in the next part. So next slide. So trauma occurs, there's kind of three E's of trauma. Trauma occurs due to an event, or it could be a series of events. It can be circumstances in life that have a negative impact, right? So for like going back to Garen's broken hand example, that was a single event. But actually, the extent of traumatization from that event is affected by the experience that the individual has. Um, how does that experience disrupt him physically and psychologically? And then the effect that it has on the person experiencing the event and their life, right? So, for instance, with Garen, if he has access to immediate medical care, he's able to manage the pain. He has a smooth healing process. And also, I know he works at home base. A home base is a very accommodating workplace, so they can make accommodations during that healing process. That trauma might have a minimal and short-term effect on his life, and he'll be able to adjust for it and then move on. Yet there's many experiences and circumstances that could result in the same type of trauma resulting in a much more disruptive and longer term traumatization, right? So for instance, if he doesn't have health care or perhaps he had previous negative experiences with healthcare and so avoids healthcare, going to the doctor to take care of that broken hand. So it turns into a much larger problem. Or perhaps he works with his hands and doesn't have a work situation that could accommodate that. So yeah, that leads to not being able to go to work and unemployment, and then can spiral into a much longer term traumatization from that same event. So next slide, we'll talk about so traumatization really results from this, these three E's. It results from an event, a series of event, or set of circumstances that is experienced directly or indirectly. But the traumatization part from trauma is that it's harmful, and it's often something that is overwhelming or life-changing. So it has profound effects on an individual's well-being, which then can impact their functioning, their physical, mental, emotional, social, and or spiritual well-being, right? So some of the experiences that can be traumatic, this is a whole list here of some examples. There's many, many more experiences that can be traumatic, but I do want to point out on this list the one in the middle, which all of us who have worked many of us for many years in the field have definitely seen, right? That economic insecurity and homelessness itself can be traumatic and can result in traumatization. In particularly, definitely for children, but also for adults. And so that experience of homelessness, or even economic insecurity that threatens homelessness, can lead to that chronic stress, from frequent moves and inconsistent relationships, just not having a place that is safe, a home, right? So I'm sure that is something that many of us have seen. I also do want to point out here that we're not therapists. Most of us, maybe some of you are, but most of us are not therapists. But it's also really important, through understanding how life experiences can result in traumatization, for for ourselves, as well as for and most importantly for participants in the programs that we're working in, how that can correlate to their emotions, their behaviors, their thoughts, also just their physical health, and can correlate on a short-term or a long-term basis. And so through that understanding, we can support environments where participants can feel more safe, can feel more understood, and therefore can feel more trusting and be more open to engaging with us as service providers, and working towards identifying goals and working towards solutions to those goals. Next slide. So, as I intoned before, trauma, can impact people in many ways, right? Trauma has a neurobiological impact. It sets off, just experiencing any type of trauma can set off our innate sympathetic nervous system response. That innate certain nervous system response sets off stress hormones. They get elevated. With traumatization, those stress hormones often stay elevated. So they're constantly flowing through our system. Our alarm system is always on. We're always on high alert. So that can then affect how we interact in the world. It also affects our ability to take care of our basic needs, to sleep, to sometimes even to eat. So it creates this acute stress response that oftentimes it's for and our bodies have this for a reason, right? When our stress response goes off, it tells our body we need to fight or flight. But also our bodies can freeze or fawn, which is like pulling back, disengaging, disconnecting. Um, so with traumatization, that response, those hormones are constantly flowing through someone's body. They haven't been adjusted back to, okay, things are safe, things are okay. Um, and so it can result in emotional and cognitive impacts, right? These lists here: depression, anxiety, irritability, the full list of emotional impacts and cognitive impacts on this screen, and most likely many more impacts that constant stress hormone response within our bodies can result in over time and have that impact. On the next slide, it shows a bit how traumatic experiences impact our relationships, right? So all of these, having these emotional and cognitive impacts, they impact our, our emotion, our relationships between people, our relationships community wide, and also with the delivery systems that support health and social needs. So relationships with you all, with service providers. And oftentimes, when individuals experience trauma and have that constant flow of stress hormones, there's that feeling of not feeling safe. Can also feel betrayed, having to have difficulty trusting others. And then those feelings are what lead to what oftentimes we see as heightened emotions in different ways. It could be anger or aggression. It could also be pulling back, isolation, self-shame, numbing. And so, these emotions oftentimes impact how someone acts in the world and the bond between the participants that we're working with and yourself as providers. And then it can have a result in the participants' engagement in services. So sometimes when we're seeing, it finding difficulty engaging participants in services, that's why it's important to have this trauma-informed lens to think through, well, perhaps there are reasons beyond what I see on the surface of why this participant is difficult to engage or angry or aggressive. So that's why we encourage within holistic services to have this lens. And yeah, I'm not going to stop to provide time for us to give feedback because of time, but I want y'all to think about, I'm sure you all have witnessed these impacts of trauma with participants in your program. So just think about that. When have you witnessed that before? Next slide, because the next slide is some good news. The good news is that not everyone experiences the traumatization. And not everyone who experiences trauma experiences these impacts, because as human beings, we have resources. We have internal resources and we have external resources that serve as protective factors in our bodies. So they help to protect us to reduce those negative impacts of trauma. So those are like internal protective factors like our health, our hope and optimism, self-determination and confidence, faith, self-worth, purpose, resourcefulness. And there's also external protective factors or resources that people have access to, which is, food, money, resources, housing. So that ties into the focus on housing, transportation, the ability to get to the places you need to be, supportive relationships, caregiving, caregivers, having mentors and role models in your life, being able to access leisure activities, to take time out and care for yourself, and having access to services and access to a community of support. So these protective factors can help to prevent negative outcomes, both in the moment when the trauma happens, right? Like I said, with Garen and his hand, um, having access to healthcare, having access to resources, um, helps to reduce that impact of trauma. Um, it can also, but the protective factors can also be adopted later to help people heal. So this is, as I said before, we're not therapists, but this is within our service provision, we can think through ways to help someone who maybe you're seeing that there have been negative impacts of trauma, of previous traumatization. How can you, thinking through how can you support them to identify those protective factors in their lives? What do they have internally? What do they have externally? How can they tap into those protective factors to start to heal? Next slide. As I said before, the experience of homelessness can be traumatic itself, right? So the participants that we're working with, just thinking through that, homelessness itself can, it strips, and as I said previously, even economic insecurity can strip away some of those, especially those external protective factors, like basic human need for shelter, for food, for safety. Also, internal protective factors. Homelessness affects people's health, affects people's hope and self-worth. So recognizing that the experience of homelessness itself can be traumatic. Trauma can also be a contributing factor to experiencing homelessness. So, for instance, with the broken hand, if as I said before, if there aren't those protective factors of, having employment that can accommodate the time when you need to heal for during the time of having that broken hand. If that's not addressed, and then that lack of employment can easily spiral into lack of income, perhaps excess use of painkillers, depression. We can see how that one traumatic event could spiral and result in an episode of homelessness. Also, systemic trauma that's ongoing and relentless throughout someone's life, oftentimes due to identity or due to the community that they live in, that can also be traumatizing and a contributing factor to homelessness. We know systemic racism, for instance, in the form of racial profiling. Someone experiences many unsafe, threatening experiences throughout their lives. Also, discrimination based on ability, sexual orientation, gender identity or expression, as we discussed during the last training. These ongoing experiences related to someone's identity can also be a factor in traumatization and also result in homelessness, or tie into the experience of homelessness, and can tie into those disparate rates of people experiencing homelessness that we see amongst Black, Native American, Latin, LGBTQ, various populations. Next slide. So this is just a quote that I think brings us all home, that traumatization occurs when both internal and external resources are inadequate to cope with an external threat, whether that threat is real or perceived. So this is from Dr. Bessel van der Kolk, is the author of, you may have heard The Body Keeps the Score, a very popular book that he wrote, but he's also been very prominent in the study of the effects of trauma on individuals, and physical effects and psychological effects, pretty much since the 80s, I think. And I feel that this quote really points out that traumatization isn't just an event, but it's the effects of not having the resources to cope with that effect, the resources to protect someone. And then that leads to that inability to handle the threat, and then the resulting feelings of, often helplessness, being stuck with, pain, fear, and, feelings that get stuck and result in that traumatization. So how do we recognize traumatization in service delivery? Some signs that we might see with participants that we're working with is participants that have a lack of trust. They don't trust in providers. Maybe they've had negative experiences, or many all those reasons that I pointed out before about the effects of trauma can result in that lack of trust. Sometimes you'll see inappropriate responses. Someone responds very aggressively or very angrily to something that you are confused about. Why did they respond that way? Also, trauma can also result in difficulty asking for help or accepting help. That pulling back, that self-isolation, and overall difficulty sustaining any type of relationship sometimes, and also long-term relationships that affect on people. So want to discuss this just a teeny bit on the next slide. Just think about, how else might trauma affect individuals and families that you're working with. Unmute or just put into chat any other effects that you all see in your work on individuals, the effects of traumatization in their lives. I'm not seeing any. Are these it? Are these the only effects that you see working with participants in your programs? Yeah, adversity to certain services. Memory. Yeah, memory and follow-up. That is, thank you, Caitlin. That's a big one. Yeah, I think that the key here is just that there are many different effects of trauma, and it can affect, we're all unique individuals. It affects people in different ways. And so the idea of being trauma informed is just really taking a step back and thinking and asking questions. Yeah, making promises. Sometimes there's the feeling like, okay, I need to make promises to make someone happy, and then sometimes there's it also ties in with some of that challenges with memory, and then so then you forget the promises or not following through. But yeah, many different effects of trauma, and I think the key point is just that that trauma can affect us in many different ways. So on the next slide, implementing trauma-informed approaches. These are 5 key principles to focus on when we're implementing trauma-informed principles, regardless of who we're working with. This is how we can implement these principles in our day-to-day, in our programs and services. Create safety, right? Prioritize both participant and staff safety, holding that that safe space, and also holding clear and consistent boundaries, because that promotes emotional and physical safety, right? By having clear and consistent boundaries, it not only protects staff, but it also tells participants that your safety and my safety are important. And that they can help to maintain safety. So asking that can be asking about if you do home visits, if you're doing a home visit, asking before you go to the home who's going to be present, making sure that that space is going to be safe for you and the participant. Also, setting boundaries around and ta- talking about those boundaries in advance around, if I am feeling unsafe with your words or actions, or either of us are feeling unsafe in this space when we're meeting with words and actions, we're going to need to cut that interaction short. Talk about that in advance, right? And say, I will ask you to leave the office, but also let people know that if that happens, you're not just going to cut them off from services. I understand that might happen. If it does, I'm going to call you the next day. I'm going to check in with you and we can talk about when we can meet again and get restarted. But really, helping to, setting those safe boundaries is part of the trauma-informed approach. Also, trustworthiness, of course, ensuring that, program policies and procedures are transparent, that you're upfront with participants about what you can and can't do, what services you can provide, and setting up predictable and reliable services. So really, talking in advance about what are the services that you can provide, when are you going to meet, what are the expectations, and ensuring that the participant has voice and choice, that the participant can set their own priorities, can decide what their goals are and what actions to take, and the timeline that they're going to take that on. So really holding the participant as the expert who has the solutions for their own lives, but might need, and really with your role being the coach, right? You're coaching them to identify what those solutions are. So that's the collaboration piece. Doing things with the participant, not for the participant. So really collaborating with the participant. So for example, during a housing search, we're sitting down and we're coaching and practicing, talking about how are you going to call about vacancies? How are you going to call to talk to landlords? Let's practice that rather than making the calls yourself to the landlords. So really, taking time to, that ties into the empowerment. So identifying, strengths and experiences, and then building on them and teaching participants what are the skills that I can help you build to really do this on your own. So really to support and prioritize your own healing, your own growth, and your own self-advocacy. Next slide. So overall, trauma-informed services in practice means that we realize the impact of trauma. We also understand that there are paths to recovery, that it's not a be-all and end-all. We recognize the signs and symptoms of trauma, so we recognize how actions and behaviors, feelings may be affected by trauma. And then we respond by integrating our knowledge about trauma into all levels of our service provision. So into policies, into procedures, and into our practices, into our day-to-day practices, working with participants so that we are resisting re-traumatization actively. So really, a lot of what this comes down to is kind of reframing our thinking from what is wrong with you to what is happening with you. So really kind of changing our internal messages around perceived weaknesses and deficits from, if we change them within ourselves, then we also help to change them within the participants that we're working with, to shift from that feeling of I'm broken, I'm weak, to I'm a survivor, I can thrive, I have the strength to figure this out and work through it. Yeah, so now it is time for a Next slide. Break. Woo! I know I need one. I've been talking a lot. But I'm putting into chat some trauma-informed care resources. These are mostly from SAMHSA. Um, just some good resources to refer to if you don't have them already. And let's break until I'm seeing it's 11:07, so let's break to 11:12. So feel free to take a break, go grab some coffee, tea, water, stretch, breathe, and I'll see you back in 5 minutes. Okay, hello everyone. That 5 minutes went kind of fast, but we're zooming through this training. So, welcome back. Hope you're able to at least to stretch a little, take a breather. I did, and now I'm ready to get going with the next half of our training. So why are we talking about this? Why are we talking about holistic homelessness and housing services that are centered within an awareness of the effects of trauma, while also ensuring that they're low barrier, that they're accessible, that they're focused on housing and person centered, focused on the people that we're working with and their strengths. So next slide is the reason why is because implementing services in this way have been found to support residential stability. They also have social benefits, and they're also cost effective. So, really overall, by providing services in this way, they improve the well-being of the people that we're working with, the people who are experiencing homelessness, as well as then the overall well-being of communities, because it helps support our ability to support people in ending homelessness in their lives, and addressing the effects of homelessness in their lives, right? So next slide, just a few quick slides to dig into what the research around this, and what we found is that supporting participants with from a trauma-informed perspective, ensuring that there's low barrier access, there's access to services and to housing, focused in on housing as the primary goal, but like I said, not the only goal, because you're providing the services necessary to support obtaining and retaining housing. Research has shown that having this holistic perspective within your service provision increases housing stability overall. So it really supports us with thinking about with empowering people, not enabling them, empowering them to find the solutions in their life, and then have long-term success and less returns to homelessness. So there's been a lot of research, especially in the early aughts, the early 2000s, that has shown that even after somebody has experienced homelessness for many years, has been chronically homeless, providing services that reduce barriers to access to those services, that really focus in on housing and implement trauma-informed approaches, and really recognize the voice and choice of participants, many studies have shown that this really results in longer-term housing stability. So there were studies, especially in throughout the 2000s, a lot were done by Sam Semberis, who you may have heard about through Housing First, a big proponent of Housing First. But many of these studies looked at Housing First focused programs that have this more holistic service provision focus, with that focus on housing, with voluntary services, really showed that the results were that retention rates in housing were from 78 to 88%, and this was about we looked at about 5 different studies that looked at those types of programs in comparison with your more traditional linear residential programs or residential treatment programs. So more traditional shelter, you go to shelter, then go to transitional housing, and you work on your stuff, and maybe you get housing. Those programs had a 30 to 47% retention rate. So really, so doing this, it's not only because it makes sense within our service provision, but also because the results show that it does increase housing stability. Next slide shows that programs that with what we're calling holistic services also foster a number of secondary social benefits that are supported by residential stability, right? So several other studies have demonstrated that this focus results in really improved overall well-being, in improved psychological well-being, increased integration into the community, having greater choice in housing and services really, supports that. It supports that psychological well-being, and also, that supports the ability to obtain and retain housing that then supports that sense of safety, our sense of being able to normalize our daily activities and really have a more secure base for self-discovery. And then that fosters a greater sense of belonging in the world and more happiness, right? And studies have also shown that as a result of this, rates of incarceration have been reduced. Also studies that compared more housing first and holistic focused programs to treatment programs, substance use treatment programs. They didn't see a greater rate of alcohol or substance abuse. So why not focus on housing and support? If you're not, if by focusing only on treatment, you're not having a different effect on reducing alcohol and substance use. Next slide. And also, cost effectiveness is not and shouldn't be a decisive factor in determining our programs and our program's value. But studies have also shown that providing holistic housing-focused services can save money. It costs more in most cases to leave a person on the streets to serve someone in emergency shelter than it does to identify housing solutions and work with them towards something that is going to work for them to obtain and maintain housing, right? To really connect them. I recall I used to do budgets for emergency shelter, transitional housing, and rapid rehousing programs for the agency I worked with in San Francisco. And that shelter budget was, it was at least 2 times higher than the rapid rehousing budget per person, right? But the end result of the rapid rehousing budget is long-term housing versus shelter, where often we saw people, continued homeless. They would be in shelter for a short term. That time, at the time, we had time limits in shelter, and they would leave and then come right back. Not that there isn't a need for shelter. Shelter is a very important emergency intervention in someone's life when someone is experiencing homelessness. But really having that longer term focus on long-term housing has been found to be more cost effective than only providing shelter or transitional housing. And really, actually, at the worst, the cost of housing and services is basically offset by savings. If we're focusing on housing and services, that cost is offset by savings in in inpatient care, emergency services, mental health services, criminal legal system costs, etc. So another reason to implement these holistic housing-focused services is that they are cost effective. And in next slide, what we're calling holistic homelessness and housing services. So those that are trauma-informed, low barrier, housing-focused, person-centered, and they're evidence-based and they're effective tools to support participants, right? But it's also important to remember that these concepts, implementing this focus applies throughout the system of care. It applies to the entire system of care, is supporting that focus. It applies to providers and through having policies and procedures that support that focus and leaders supporting that focus, and then staff actually implementing trauma-informed, housing-focused, low barrier, and person-centered services, right? It also requires a lot of practice. That's why, that's what I saw earlier in all those 3s and 4s, right? We know the concepts. You can hear me talk about them for 2 hours, but really we need to practice. And it also requires the support from the organization and really, the culture to support that. But overall, it's better for participants and it's better overall for solving homelessness, which I think we're all in here to do, right? Next slide. So by combining all of these, going back to where we started about how this all comes together, we see better outcomes. That's really what it all comes down to, right? We see better outcomes for adults and children, positive effects on housing stability, decreases in crisis-based services and increased cost effectiveness, and overall more positive responses from both providers and participants. Next slide. So this is kind of the how we, when we add all these together, what they result in, when we add together working from a trauma-informed perspective, providing services that are low barrier, housing focused and person-centered, it results in housing stability and it results in overall well-being. But how we do this is kind of on the right side, kind of moving through by removing obstacles and barriers to services. Then participants can engage in supportive services. They can engage in an environment that reduces their stress and increases their sense of safety. That then allows participants to, start thinking beyond that immediate crisis that they're in, right? To really start to problem solve, to identify their own solutions, to feel like, yeah, I can do this, and work collaboratively with program staff, work collaboratively with programs, to then mobilize their own strengths, mobilize their internal and external resources, or identify, so that collaboration is to identify those resources and then mobilize them, and then overall resulting in promoting healing and well-being and resulting in the goal of housing and stability and long-term overall well-being. Next slide, but I wanted to double check. I'm not seeing any questions coming up. Oh yes, I see one question from Mike. Will we have access to these slides? Yes, I'm going to post a link to the slides at the end of the training, and we will also probably send them out via email. So let's just briefly talk about engaging participants with these services. How are we doing that? How to do this? Because I know that sometimes, these concepts are really nice in theory. It's nice to sit here and as I said, talk about them for a couple hours. But it's more difficult in practice, when you're actually trying to engage participants. There's often many reasons, as I discussed a little bit before, why participants might not engage or accept services that we're offering. So before we dive into it, we're going to dive into some scenarios in just a moment, but I want to go over some tips. First tip, create a welcoming environment. This is something that hopefully all of us can do. Just think through, what is the environment where you're meeting with participants? Can you offer privacy? Can you brighten it up? Can you ensure that it's clean? How can you make sure that it's a welcoming environment, that it feels safe? And are there ways that you can accommodate also? Like if your participants have children or pets, what are ways that you can accommodate that within that environment? Being really proactive with offering services. Key is that services are not required. We're not mandating services for program participation or to maintain tenancy. but really offering them. So being proactive in offering them means that you're providing, multiple ways, multiple points of contact, multiple ways to ensure that participants know what services are available, what you can, and also what you can't provide, right? Talking about it in intake, having community meetings where you're talking about what services and options are available, doing direct one-on-one outreach. So thinking about different ways can different ways to proactively reach out to participants and let them know about what you can provide, and being transparent about what the program structure, what you can and can't do. So really being open about what is the program about, what program, have program information available, and having that available in multiple forms, in various languages, so written, visual, audio, ensuring that there's access to the program information and that it's clear and transparent. So you're not setting up expectations that you can't meet. And really, explaining as much as possible at the beginning of your interaction with participants and then repeating as needed. And having an open door policy to answer questions as they come up. So ways that ensuring that those services are accessible, that they're also ensuring that there's flexibility, talking with participants about what do you need to be able to access my services? Are there any disabilities, any what's your language of choice, any neurodiversity needs, any ways that you can make the services more accessible to participants, and talking to them about that. Also thinking about schedules, talking about when will it work best, what are barriers to meeting with me, and then maybe thinking through, are there childcare issues, are there pet care issues, how can you help participants to think through addressing those issues, or providing spaces that are accommodating to children and pets, maybe have games and toys depending on the age of the children, that available so participants can bring their children, or maybe see if there's different ways that you can assist the participant with identifying child care or pet care so they can take that time to meet with you. And also being flexible to to changes when things come up, because things can and do come up, right? Co-creating a service plan, so really working with participants together to identify their strengths and meet their unique needs, and really understand what are their motivations, what is their desire, ability, reasons, and or needs for change. That's a motivational interviewing thing that we'll probably go over in a different training, but talk to them about what do you want to do? What is your desire? What do you feel like you can do right now? And take it in small pieces, right? Those small steps, so that you're working with participants to identify what is the change that they want, and how can you support them and coach them in making that change. Always respecting their right to make choices, but also to make informed choices. So ensuring that you're providing the information that might assist them with making those choices. And, thinking about what would make the time, the energy, the inputs that the participant needs to put into needs to dedicate to meeting, not only meeting with you, but to the services that you're providing. What will make them valuable to the participant, right? I'm not gonna do something that doesn't seem like it's valuable to me, especially when I have limited time, when I have so many different things going on in my life. Thinking through what is most valuable, and how can this be valuable to the participant. And also sometimes, thinking about, are there ways to incentivize engagement? Sometimes, in programs I've worked with, we've had like small incentive programs. Are you able to maybe provide a small grocery gift card for engaging in services, or participating in a community meeting, to celebrate meeting goals? Um, and and some of that is depending on your role, working with your program management, or with your program director, coordinator, to identify what are ways that we can support and incentivize engagement. And on the next slide, just a reminder to always remember the key principles of trauma-informed care. Safety, demonstrating that engagement will feel safe, and establishing kind of a plan, talking in advance about a plan, as I said before, building that trustworthiness through transparency, ensuring that participants have voice and choice to direct their services and to guide what their priorities are, and really being clear on services schedule, on the location, but also being flexible to participants' needs. Collaboration, working together with participants to identify what are their priorities, what are their action steps, and then empowering participants to meet their own needs, and to really encourage capacity for self-advocacy. So yeah, overall, this is concepts to think about when the services you're offering meet participants' needs. Just thinking about, are they valuable? Are they easy to access? And ensuring that they don't trigger any re-traumatization, right? Now, next slide. Because now it is time for our scenarios and discussion. But first, are there any questions or thoughts before we're going to go into some breakout groups and start to talk about some scenarios and think through how are we implementing these concepts that I've been jabbering on about? Any questions before we go in? Or comments? Not seeing any. Okay. We
I'll
can.
share.
Oh yeah, thanks, Mike.
I just want to say thanks again. This is super beneficial how we, show up for clients. But I checked out the toolkit that you put at the home base box, and it's showing how we can like have an analysis on ourselves as service providers. Like, how are we showing up? How is our staff showing up? And like a little analysis and assessment so we can have for ourselves internally. I'm all about like lifelong learning, so I just really appreciate the client side and the service side as us as service providers. So thank you so much for this.
Yeah, exactly. Thanks for bringing that up. Because that, yeah, as I said before, like this trauma-informed training can be like it could probably be at least a 2-day training, and many people like actually get certification in trauma-informed care. But I think that toolkit that I shared has a lot of resources and information that can really help to support you all in, yeah, like you said, Mike, looking at ourselves as well as at our participants. Any other thoughts or questions? Okay, well, yeah, I don't think we need to put the slides back up. What we're gonna do is I'm putting a link into chat that have 4 different scenario slides. We're gonna break us all into, I think, 4 breakout groups. So might be about 10-ish participants in there, and we will have one facilitator